ישיבת קורונה של הבוקר של הנהלת בית חולים, כדי לזכור את כל הפעילות, ונתחיל. קובי, לגבי... אתה נוח לך בבגדים, הכל בסדר? יופי. ברוך, בוא תספר לנו מה היה בלילה.
אתמול קיבלנו חלחת קשה, 92 אתמול שהיו פה כבר במחלקה, אז אנחנו עכשיו 3 מונשמים ו3 לא מונשמים בבית.
הבנתי. ויש לנו עוד חולה פנימי שאמור לעלות למעלה?
כעת לא אין לי נתונים כאלה.
והמונשמים הם בפרון או שהם עדיין...
אחד בפרון, שאנחנו צריכים להפוך את בחזרה, הוא הגיב מאוד טוב מאוד לפרון.
הוא הגיב טוב לפרון?
כן.
יופי, מצוין. יופי, אז תודה רבה. תודה רבה, סליחה. We are continuing to treat other patients. And I can say in somewhat proudly that we were working a lot with the radio and the television and also the internet into Jerusalem area, making people understand that while there's a coronavirus, they shouldn't be afraid to come and get treatment in the hospital. One of the things we've noticed in Israel, and I believe you see in other countries, is that because of the coronavirus, people are afraid to come to hospitals. And we've invested a lot of explanation and public relation, trying to make them understand that we are, at this moment, very well equipped to treat separately to both the corona patients and the regular patients. There's no reason that someone with a cardiac problem or someone with a neurological problem, with a stroke, will not get the best treatment that we are used to give to our patients at Hadassah. And for this reason, I'm proud that although I shouldn't say, unfortunately, we're not fully with a full occupancy of the hospital, but we're sitting as around 75–80% occupancy in a lot of the departments. And this is very encouraging because it means that the patients are starting to come back and they understand that the coronavirus is here to stay with us and they need to treat also their other problems. As I explained, we cannot afford emptying the Davidson building and we need your assistance for the equipment in order to treat the corona patients. We're going now into the Pesach holiday. We are very concerned. We have created an infrastructure up to now of 82 beds, together with a possibility to treat more than 38 or actually even more, 42 intensive care patients if needed. But unfortunately, there's a possibility we need to treat much more. When I'm saying we have the infrastructure, is we have the infrastructure, but please don't misunderstand me. We don't have all the equipment. And I do hope that as we gather the equipment, the patient will not come and force us to run quicker than we're ready, but I'm sure that we will be able to confront the problems we have. One of the things that I've initiated, and you saw it actually in the picture that we showed you at the beginning, which I didn't realize that Hadar took, is a daily meeting that is taking twice a day. And during the Shabbat and Friday, it's being done by phone. And this is the control center of the hospital for the coronavirus and for the entire operations of the hospital. Twice a day, all the key stakeholders of the hospital are meeting in a large meeting room. We're sitting more than 2 meters in distance, and people are joining us on WebEx. And we're discussing all the issues that are related to the proper functioning of the hospital. So first of all, also that our workforce knows that their protective equipment is there. And as I said, when we started preparing for the coronavirus, the first and foremost issue that I brought up was that we have to be sure and we have to explain it to our team that the thing that we are interested for most and above everything else is the safety of our workforce. When a nurse or a physician go into the corona space, they should know that we have provided them the best protective equipment, and we're following that every day. We have created special conditions for people to get dressed and take off their clothes in order to be sure that when they undress, we don't get someone by chance infected by the coronavirus. I can say proudly that we're running it now more than 2 weeks, And until now, we didn't have even one people from the workforce that was attained by the coronavirus, neither a nurse or a physician. And I hope that this will be also the continuation. This is really where I think as a management we are being judged, but also in another issue. And this is that corona patients that are quarantined or isolated in these departments, some of them are coming also with other problems, medical problems, and that their other medical problems will be attained to the level and standard that we are used to providing at Hadassah, at the same time that we take care of their corona problems. I think that I will stop here and I will let you ask questions if you have any questions. I would like to wish all of you really a happy Passover, and I hope that you really, in your different countries, maintain the safety of your family and your peers, and you keep your hands clean, and you keep your distance, and you keep your isolation, because at this point at least, this is the most important part of what we can do. I suggested I'll stop here, and then if it's okay, Jorge, I'll address a little bit the issue of research on coronavirus that is also being done extensively at Hadassah, and I'll explain what we're doing also on the clinical part.
Yes, thank you, Yoram. For everybody who is on the call, please keep your phones, your mics, mute. And if you have questions, you can put your questions on the chat. I'm looking at the questions, and we are going to be sharing some of these questions to Yoram, to Professor Yoram Weiss. So first of all, Yoram, before you go into research, I want to welcome, there are several doctors, medical personnel, some administrators from government authorities from Mexico particularly, I don't know if from other countries that have joined this call. And I think one of the questions that they have sent to me is, from your perspective as probably I don't want to say the most important director, because other directors of hospitals in Israel are doing great job at the same time, but I would say with all pride as an Hadassah member, I would say one of the experts in this in Israel. What is the advice that you can give to countries that are 4 weeks behind the Israel experience in how you, as an expert in the field, what you would recommend them to do right now when they are only starting?
I think that what I would recommend is, first of all, at the national level, to do in a way what the Israeli government has done, and this is to very early start and using the idea for the population to understand that they need to isolate and they need to not to congregate in large groups, because this is a problem. When it comes to the hospital, I think that what you need to do is you need to make people understand that, first of all, they have to understand that even if they're not in a corona space, they need to wear masks. They need to be very much aware of cleaning their hands when they move from one patient to the other, also in public spaces. And the other thing is to work in something, as I said, that we're not used to, and this is small capsules. Because if you don't do that, you can finally find out that you have an entire department that is wiped out, and it happened here in Israel, because the one person is actually infecting everybody else. It is extremely important to understand those who don't understand the coronavirus, where the coronavirus is really problematic and is completely different from SARS, that a very large percentage, we don't know yet how much, but a relatively large percentage of quote-unquote patients can be completely asymptomatic. And for this reason, you can have a workforce, a person, a physician or nurse that comes to work, they feel fine, but they are basically infecting other people. And for this reason, we also decided to do our surveying our population of nurses and physicians in specific departments to see if they are carriers of the virus without knowing that. Another issue I should say, which is extremely important, is to fight something that is very common here in Israel, and this is people, because of their devotion to work, they come sick or partly sick. They have a running nose, they have a sore throat, they have some fever, they come to work. For the coronavirus, it's extremely dangerous What we had really to make people understand and fight against it is, if you have signs of sickness, do me a favor, do not come to work, because you're putting in danger, you're not helping the system. By coming to work sick, you may actually infect with coronavirus your entire team and other patients. So this is something that you need to remember. And the other thing is that you may have, it's very important to survey the community, because you may have patients that come out certain neighborhoods that they, without knowing it, bring the coronavirus, import the coronavirus into your hospital. And unfortunately, you need to understand that if you have this data, you need to understand that some groups you must in a way isolate also within the hospital in order to protect other patients. So I'm making it very simple, but I'm trying really to summarize the issues that you asked me about and what is our concept.
So, you know, Yoram, this is connected to another question that is coming. You have spoken about the testing of all the medical personnel, or a big part of that, in a very strategic way. And, you know, that I think, you know, Hadassah has been a leader of this, Israel definitely, and, you know, one of the leaders in the world in starting doing this. And the question that some people are asking is, when you look at the number of ventilators that we need and we will need, are we having at the same time a backup in terms of the medical personnel that will need to handle a much larger amount of ventilators if these things spirals up, you know, over the next few weeks?
So about the personnel, I mentioned it before, but I will reiterate it. And this is that over the past 2 months, what we started to do is we started taking, first of all, we have a large anesthesia department. So not only internal medicine is dealing with the coronavirus, when it comes to intensive care patients, also our intensive care anesthesia department is taking care of them. And this is about 100 physicians, add to that to the internal medicine physicians, who are also about 100 physicians. But what we did, and this is very important, we started working and training surgeons and orthopedic surgeons to work as assistants in the intensive care unit. We taught them once more how to use ventilators, what are the protocols to use on ventilators, how to give orders to nurses when it comes, simple orders when it comes to patients that have acute lung injury. So we also starting taking these people and convert them in a way to relatively not senior, but junior intensive care physicians. This is critical. And finally, what we did is we took a lot of our technicians in the hospital and paramedics and people that are assistants in the hospital, and we are training them now to make ventilation technicians, or respiratory technicians as they call it in the States. Because one of the things you need is you need to have a lot of support people to maintain all the ventilators that you have. That at Hadassah on a regular basis, during the winter, we're providing service to about, at Hadassah Ein Kerem, to about 100 ventilators. But here, if I have to have 300 or 350 people that are ventilators, I have to have many more respiratory technicians, and we had to train them for that. So these are activities that are happening on the background in order to have basically all the personnel we need if we have to ramp up to about 300, 350 patients.
So basically what you are saying is, on one side you have the equipment, on the other hand, you are working on getting the equipment, on the other hand, you are preparing the medical personnel and training those who have to be trained or retrained or reminded of what they learned many years ago to be able to run and expand the ICU unit or units for COVID-19. And then there is a aspect of this that is coming in many of the questions, which is, what are the treatments, what are the medicines, what are the therapies that are used now that can be effective? And there are two questions that come, you know, from different people. One is about this very latest news from the last, I think, 24 or 48 hours about the Avigan that came from Japan, and Hadassah has been chosen as one of the places to do some experimenting with this and start using that as part of the clinical trial or some kind of trial. And second, there is a whole hype about the hydrochloroxyquine, which, you know, in some cases has been declared as the Dalia, or the big remedy for all COVID-19 patients. So I want you to refer to these two specific medicines or medicaments, and then if there are any others that you want to include, because there are so many questions about this, and you have probably one of the best perspectives in the world.
So as you said, one of the problems is, I'll be blunt, we don't have, at this point, we don't have any proven therapy for the COVID-19 virus.
Okay.
Let's make it very, very clear. The best treatment we have today is supportive treatment, which is ventilation, oxygen, and other supportive treatments. There are several medications that are on the table. First of all, you have the hydroxychloroquine, which is being brought up, and there are many people who believe in it. The idea behind the hydroxychloroquine is basically that it's blocking the ACE2 receptor, which is the receptor that allows the virus to penetrate. And for this reason, it is most probably much more efficient if you start it as early as possible on your patients. And this is actually what we are have decided to do. If we have a patient that is, not all the patients, but if we have a patient that is developing symptoms of shortness of breath, requirement for oxygen, we start him on this. The other drug that you mentioned is actually an interleukin-6 inhibitor. And this came up from not only in Japan, but also in Italy, of a few patients that were treated there. This is a treatment that is provided more as a rescue treatment for those that are most severely injured, that have the acute lung injury and also the sepsis, which is the heart injury or the kidney injury that goes together with the lung injury in the COVID-19 patients. And this is because the virus also attacks the heart and the kidneys and can actually cause a cytokine storm. What we think today is that the virus, when it goes into the lung and attacks the lung and then goes into and attacks the heart or the kidneys, it provokes a very strong pro-inflammatory response. For those who are not physicians, it's as if the body is developing an autoimmune response against the virus and against the tissues that have the virus. And there's a cytokine storm, which is a very severe anti-inflammatory response, that starts. Interleukin-6 is one of the cytokines that is associated with this activation. And the drug that you mentioned is actually basically a blocker of interleukin-6. We have two studies that will start using this drug on patients that are have severe acute lung injury or severe signs of the COVID-19, including also hemodynamic instability. However, I should say that you need to be very, very careful, because if you provide this drug to someone who, on top of the viral inflammation, has also a microbial inflammation, this is very dangerous, because by blocking the interleukin-6, you block the inflammatory response and the ability of the body to fight microbes. For this reason, a lot of people are recommending, before you start this drug, to use also to do a test that is called procalcitonin test, and to see what is the level of procalcitonin, only if it's not high to start this drug. So, as I mentioned, there are also a lot of other drugs that are on the market. A lot of these drugs are addressing either preventing the virus of penetration. The virus is using protease, a protease system, and I'm using a little bit of medical words, so I apologize for those who are not physicians, and ACE2 receptors on the respiratory epithelium and the alveolar cells. And what we're trying to do with these medications is block the entry of the virus into the epithelial cells and the alveolar cells and prevent the inflammation. And the other side of drugs are drugs that are in order to reduce the inflammatory response. So these are the two drugs that are now being used mostly, if I'm looking generally on all the other medications. As you know, when you have such an epidemic, what's happening is that there are a lot of people are coming with a lot of medications. So in order to create some order in what we call in Hebrew balagan, which is a mess in English. What we have created is I put in place a committee which is called the Hadassah Medication Committee and Standard of Care Committee. This committee is reviewing all the medications that are being brought up as possibilities, and every few days, every week or less than a week, the committee is meeting, is reviewing all the literature, and there are key opinion leaders in the hospital who are reviewing this. We're looking at what the Ministry of Health and what the scientific papers have said, and based on that, there's a revision of the standards of care for the Hadassah team of what medications to be used and what medications should be pulled out based on what is being published in the general literature. I think I'll stop here and I'll let you ask
questions. Yoram. So I think, one of the things that, characterizes Hadassah is to be also a leader into medical research. And, at this point, we are handling, all over the world, we are handling this the best we can with different therapies and medicines that are in the market. But I'm sure, and I know you want to speak about that at Hadassah, we are thinking about what's the next thing that is not in the market that we could use for our patients in Israel, but then for everybody else around the world. And that goes, for example, to one of the questions that people are asking, if we are starting to use antibodies from people who have already gone through coronavirus and now they are healthy and with antibodies to create plasma and all these kind of things, which leads me to the question of what is Hadassah doing to find solutions for the better treatment, more effective treatment, and eventually the cure of COVID-19?
So I'll start with a serological answer. So first of all, what we started to do at Hadassah, and actually now also the government of Israel has initiated it with Magen David Adom, is to try and survey all patients that were sick and to do a test of the level of, first of all, if they have developed immunity, which means that they have developed a specific antibody called IgG. And if it is IgG exists, to see what's the level of the IgG. And because we don't have yet a medication, as the FDA has approved, we're starting to think about it to do it in Israel, to extract from patients that have recovered the IgG if they have it in high levels, and to give actually a plasma treatment of IgG to those who are extremely sick in order to bring down, by using these antibodies, the virus and kill the virus. The FDA has approved it about a week ago. We have already done surveillance tests for serological on patients that were at Hadassah and were discharged. We went out to the hotels that they're staying into their homes. We're going and taking serological data, and we will try and find those who have the highest level, and then to try and use their plasma in order to treat patients that are acutely ill and do not respond to the regular therapy that we have at our hands at this point. So this is regarding the plasma therapy. The other thing is that there are a lot of studies that are being done at Hadassah that we're starting, some of them in the laboratory, some of them are doing on animals, and some of them are in humans already. We have initiated a specific IRB, Institutional Review Board, to allow all the studies that are being done, research studies, to being done at Hadassah to be reviewed by a very fast-track institutional review board. This committee is meeting once a week, looking at the studies and then prioritizing. The idea is that we are very careful not to allow studies to take place if there's a chance that these studies may cause more harm and put in danger the patients. So we're really trying to make it that although we want our physicians to do studies and to put in new medications, what we want to be sure that we'll do it in a safe way with appropriate controls and with appropriate safety guards to really not cause any harm to our patients. And this is very, very important in a kind of epidemic where everybody's rushing with new medications and new ideas. I could mention that one of the really interesting things is the treatment of Dror Mevorach, who's using apoptotic cells in order to reduce the pro-inflammatory response, as I mentioned before. So this is already being done, And actually, he treated also already a patient not in Hadassah, but outside of Hadassah, in Bellinson in Tel Aviv, to help them fight a young patient that had a very severe COVID-19 infection to try and stabilize her. And it looks as if his treatment was helpful in treating this disease.
Yoram, there are many questions, and I have to apologize with many of the people who send questions because of the time. We have to, some of the questions, you will be able to send this over to Yoram and get answers through emails to everybody, to the whole group. We will ask Yoram to do this later, so you really get answer the questions you sent. But there is one question that is coming again and again, and it's, what's your forecast? I mean, where, when, and how do you see us, and I say us by the word, Israel, when do you see us and how you see us coming out of this?
I'll answer what I'm answering a lot of people that are asking me this question, and I'll say that prophecy was not given to those who are very clever. And the answer is, and I'll be open with you, I have no clue when it will end. All of you have heard that there's a theory that now with the warming up, that the summer is coming most probably. People are saying that the COVID virus, which is a coronavirus, will suddenly abate and disappear and maybe come back during the winter. I should say that I have my reservations about that, because if we look what's happening in Africa now, if we look what's happening in the Philippines, if we look what's happening in Singapore, which are very warm countries with 30 degrees temperature all year long, and you see that the coronavirus there, not only that it's not abating, but on the contrary, I heard just today that Singapore, that had under control the virus, is now put in place very stringent isolation guidelines because they're losing control of the virus. So I have no clue. And I'll say also, I have no clue when we'll have a medication or vaccine for the virus. I think it is very important to understand that even if we go back to normality, there's a very good chance that the going back to normality will be very, very gradual. And please keep in mind that the virus is mostly, although it's attacking also young people, but the mostly people that are in danger of this virus are those that are older than 60, 70 years old, and especially those that have comorbidities, that have other diseases, lung diseases, heart disease, neurological diseases. These are the people, and obviously those that have immune suppression. These are the people that are at the highest risk of infection. And for this reason, here in Israel, we are putting a lot of emphasis on isolation and quarantining the elderly population in order to protect them from the virus. And most probably we'll allow the younger population to come out of isolation very, very slowly in under control condition within 3 weeks to a month, I believe so. But this will be a very gradual process.
Thank you, Yoram, so much. Thank you for your honesty. Thank you for your leadership. Thank you for being there for the people of Jerusalem and Israel. And stay with us for a few more minutes. We want you to be at the end together with everybody on this call. It's a few more minutes, but thank you so much for making yourself available.
Yoram, thank you so much, Yoram.
Thank you, Dalia.
Please,
thank you very much. And Chag Sameach to everybody.
And send to all your staff. Thank you so much. And we are so proud of you and with them. Thank you so much.
I'll do so. Thank you.
Now I'd like to turn over to Hadassah International's Executive Director, Melissa Kaplan.
Thank you so much. On behalf of Hadassah International, I want to thank you, Yoram, for such your stunning leadership in this crisis. And you know, Hadassah Hospital has really led the way in the crisis in Israel and really in the world. So it's a privilege for you to be joining us. Also, Dalia and Rob, thank you for being with us. And it's a privilege to have people from more than 15 countries around the world joining us on this call. So we thank you for taking the time out to hear about what we're doing. I'd like to note that for any doctors or medical personnel participating on this call, please be in touch with one of my staff on the crisis response team, Jean Vachon, who is we'll put her email on the chat. If there's anything we can do to support you, please be in touch with her and we'll get back in touch with you. So I want to just give you a very quick brief on what's been happening at Hadassah International. Hadassah International has a global network of passionate volunteers and professionals, men and women, who immediately mobilized 3 weeks ago, and we formed a global crisis response plan. And that was twofold. Our approach is twofold. So the idea was to employ a community-based approach, utilizing this nimble infrastructure that we have globally, whereby we partnered with local communities in our various countries to assess where are their governmental gaps and community gaps as COVID was spreading in Italy, Spain, and Israel. You can visit our crisis response website for more information. We'll put that in the chat. And just to share with you a few of the initiatives this crisis response team on the website, you can actually go and see many of our initiatives that have been launched just in the last 2.5 weeks. Yesterday, we had a call with over 300 people from 13 countries with medical staff from Hadassah and other hospitals in Israel that Hadassah Australia put together and coordinated this webinar about emergency room protocols and ICU protocols. It was a very stimulating conversation. We've gotten a lot of feedback from it. Again, that's somewhere we felt like we could promote what Israel is doing and create a conversation with other hospital administrators and ER staff. So if you would like for the doctors on the medical staff on this phone call, if you'd like a copy of that webinar, again, please be in touch with Jean and she can send that to you. Hadassah Mexico, I see several of our leadership on this phone call, Fule Zaga, I see Isaac Zonana, and we over 2 weeks ago, when Hadassah Mexico realized what was happening in the world, mobilized the Jewish community and put together with Jorge and Ethel and our team, put together protocols that they could start to promote in Mexico to prepare them for what was coming. They have been working nonstop to support the Jewish community there, and I just want to commend them for all their work, and it certainly is not over. I'd like to mention what has been happening with Hadassah Argentina. Hadassah Argentina, led by Jorge Diener and several of the volunteers there, and Fanny Reebok, who is on our call. They have been partnering with very high-level businessmen and women in the community, again, preparing what was coming. They're looking at a plan for how to support the elderly in Argentina and Buenos Aires, and many other initiatives they're doing across Argentina, and really showing their leadership. And again, just thank you for those in Argentina joining us for this call as well. We've been focused on, and Natalie Dweck from the UK has been raising this issue for a couple of weeks, focusing how can we support ultra-Orthodox high-risk populations. So that's ultra-Orthodox, that's religious Muslims, focusing first of all in Israel. And then how could we apply that in other countries? We know in the UK, in New York, there are very serious outbreaks of the virus. And we are in discussions with some doctors at Hadassah, how we could partner in those local communities within Israel in order to share some of and create protocols for these unique populations. Anything else? No, I think that's it on the crisis response. If you have any questions, let us know about that. The other critical part of our crisis response plan has been our emergency campaign for the hospital, for our Hadassah, beloved Hadassah Hospital. We've had many generous donations from around the world in supporting our needs at HMO, some of which you heard from Yoram this morning. We built we have converted a hospital for COVID patients. And there are, as you heard, the serious patients in the Jerusalem area are coming to Hadassah. So there are many ways you can participate. One is we had a very, very generous donation from the US, and they have provided a match opportunity. Our Hadassah office in Israel secured that donation, and I'd like Gidon Melmed, our head of donor relations at Hadassah in Israel, to just talk for 1 minute about that match opportunity that you could promote in your own country. Gidon?
Thank you, Melissa. I think this is a wonderful opportunity, really, to many of you are aware, but it is now official, and I'm glad to share that a generous California-based family foundation will match every dollar given up to $3,750,000. That's $3,750,000. So any donation now has the potential of making twice the impact. For those of you who are interested in learning more about the specific needs, I'm sure we'll follow up after this with a list of needs for those of you who haven't seen yet, but there's the website of the Hadassah Global Response also has a list. So this matching opportunity is now available for all new gifts.
Fantastic. Thank you, Gidon. Also on our website, we have equipment lists for the campaign, and please feel free again to ask us if you have any, be in touch with us if you have any questions. We also have a really wonderful opportunity. I'm just coming off of a phone call with HWZOA, our Hadassah USA organization, based in New York, just coming off a call with our leadership there, and they have very generously agreed to sponsor 2 campaigns I'd like to share with you. We will be, for the Israelis on the call, one way you can participate is, and certainly anyone else, we will be launching a crowdfunding campaign in Israel, hopefully this coming Sunday. So we are mobilizing, encouraging you to be involved. This will be an online campaign for the critical work we're doing in Jerusalem, and we look forward to your support. So everyone, please, you will be receiving information about that campaign. Also, next week, we will be partnering with our brothers and sisters in the evangelical community for a massive global campaign that will be, saving the people of, saving lives in Jerusalem by the evangelical community. So in advance, we thank you for your support. And I know we have some members of that community on this phone call today. So please stay tuned, and everything we'll be offering, we'll be sending you, we have your email from this call, we'll be sending updates. We will circulate a recording of this call to all participants. And with that, I would like to thank Jorge Diener. I'll be turning it back over to him to close the call. He's been working tirelessly along with our team at HOI, Hadassah office in Israel, on this crisis response campaign. And thank you for your partnership and leadership, Jorge.
Thank you, Melissa. We are going with the Jews in this call. We are going to be celebrating tomorrow night our Passover Pesach Seder. And I was thinking how to close this call, which is just 24 hours before we get there in Israel and a few more, some other parts of the world. And you know, actually, I was thinking about the name of the holiday is so relevant for what we are going through all over the world. Pesach, or Passover in English, was basically to pass over the houses where people were isolating themselves to be saved. And that's what we are doing now. And then I thought, okay, there must be a meaning to the fact that we are all staying safe at home so that the virus pass around the house and doesn't get into us. And then I thought, there are two things that I come out from this experience we are experiencing. I think half of the world population being secluded in our houses. And one is, we had to stay home in the Exodus story because the one that was to be killed was the oldest son. And now we live in a period where the ones that have the highest chance of being killed by the virus are the eldest in the community. And staying home, even if you think you can survive, is about protecting the oldest son in the family and the oldest sons of the world. And then I thought that if there is something that connects what we are doing staying home and what those who are not home in the front line, like Yoram and all the medical personnel and all the doctors who are out there, our soldiers defending ourselves and defending our continuous existence as humankind, is the fact that the story of Exodus was not a story of one hero that ran away from slavery. It's a collective effort of a group of people who only together could cross the river and only together could move from their enclosed homes as slaves to a collective freedom. And this is exactly what I think we are doing now, when in a minute we will put together on our screens the sign of Together We Live, because there is no other chance and no other way to remember that in every generation we should behave as if we were going out of Egypt today. Nothing better than remembering that each one of us has a way to express our collective responsibility to get free of the danger we face today. I want to wish everybody, Jews, Christians,
Jorge, thank you very much.
who are on this call, I want to wish a wonderful holiday and to get through this the best we can together.
Thank you very much, Jorge, for this wonderful initiative.
And now I invite everybody just to get your Together We Live signs.
Hey.
On the screen.
Unmute your phones.
Taking the picture. Please
You can
smile,
unmute
everyone.
Everyone, right? You know where that, you know, we can see. Oh yes.
All right. Feel free to
unmute.
You can unmute your phones and your computers now.
I will unmute all so you can say whatever you want. Together we live. Now everybody.
Together we live.
Together we live.
Thank you very much.
Together we live.
Together we live.
Chag Sameach.
Chag Sameach.
See you all. Oh, hi, Natan Karak. I see you.
Leave.
Hi.
Hi. Wonderful to have you.
Thank you for the beautiful words.
Beautiful people.
Very proud everyone.
Everybody.
Very proud
to love.
Very nice.
Thank you,
I look forward the time when we can all meet together and raise a glass.
Amen.
Together, hopefully Jerusalem at Hadassah.
Amen, Sherry. Thank you.
Toda la gente de Latinoamérica, toda la gente de Latinoamérica, México, Argentina y otros países que nos acompañaron. Muchas gracias por estar presentes.
Gracias.
Thank you, everybody. Goodbye.
Thank you to all our U.S. colleagues and volunteers for joining. It was wonderful to see you.
Sending love around to everyone.
Yeah.